In April of 2000, I had a dual discectomy, a decompression infusion to correct a problem that I have, which is called degenerative disc disease. I had been suffering with pain for many years before that, and treatments, medications were ineffective. So the decision was made to do a dual discectomy, decompression infusion, where they actually remove the discs that are having a problem, and they fill it with bone, and they fuse the spine with rods and screws. The surgery was successful, but during the time frame that I was going to physical therapy, they made some inappropriate recommendations, and against my better judgment, they requested that I bend over and touch my toes. Because of my mentality of trying to be successful at everything, I did attempt to touch my toes, and as I was going down, I actually felt screws loosening in my back. I was in agonizing pain, so from there, in January of 2000, then I had to have another surgery where the doctor had to remove the screws and then actually put longer screws in, which went almost through my spine. I was fairly stable at that point. I've always had some back pain, but taking moderate medication, I would try to function. I'm a very active person. I ride motorcycles, I have 5. I function like a normal person, but the pain was getting to the point where it was affecting my quality of life.
When I first met Rick, he was very distraught, both physically as well as emotionally. He was in a tremendous amount of pain, unable to get really any sleep, and he was, significantly sleep deprived. Rick's real passion is to be able to ride his motorcycles, and that's what he likes to do, and that's what keeps him sane, that's what keeps him happy. And unfortunately, with this problem, he was unable to do that. I
had a dual laminectomy, where the back of the bone was removed from my spine to relieve pressure on the spinal cord, and that was supposed to help relieve the pain. For a short period of time, it did relieve the pain. However, the structural integrity of my spine was compromised because of the bone being missing and tampering, of course, with the muscles and the cartilage. So my spine shifted forward. I was unable to stand upright. I had to sleep in a fetal position. I was in agonizing pain. I woke up in the morning screaming in pain. I broke down crying many times because I was so frustrated. My first 3 surgeries were done at a hospital in the city. When I first met Dr. George at NSPC, I was walking over like a primate. I couldn't stand up straight. To look somebody in the eye, I would have to roll my eyes up top. I tried to stand up straight just in an exam, and I was screaming in pain.
He was barely able to look at us in the face. He was really severely slumped over. He had a big deformity that he wasn't able to correct, when he was able to correct it, he was in agonizing pain, so he had to constantly stay slumped over. And this was obviously a really active person, very physically active, and this is really obviously affecting his lifestyle tremendously.
And then in a conference with him, we went over my options. He felt that he could possibly get away with doing 3 or 4 discs, but in his better judgment, he felt that possibly doing my whole spine up to T4 would be more appropriate, considering the fact that I still have degenerative disc disease, and ultimately I would wind up going back in.
This is a big enough deformity that we really thought it would be best, given his numerous previous surgeries before, that we get as many fixation points as we can to really correct his deformity and to put him back in realignment so that he's standing up straight. We proposed a plan to him. Obviously, it was a much bigger surgery than he's ever had, even though he's had 4 other surgeries, 5 other surgeries before meeting me. This was, much larger in scope. And obviously, we had a long discussion about the risks, the benefits, and the alternatives, we were able to provide him with a good degree of certainty that he would improve significantly with this operation.
I was very concerned with how long the recovery would be, considering the extent of the surgery that he was going to do, but he reassured me, and I think that was probably the best thing because I have complete confidence in him.
The operation went uneventfully. It was a long procedure. It required a tremendous amount of work, and he did very well post-operatively. I would venture to say he has done significantly better than anybody else who would have a similar type of operation. He's done really well, and that speaks to his personality also. Rick is the type of person that wants to be the best at what he's doing, and that's the same thing with recovery. And he's done extremely well as far as recovery is concerned from this this really tremendous surgery that he's had.
When you have somebody that is going to do a major procedure on your body, you have to have that trust. But I did some research before the surgery, and all of Dr. George's marks were great. Everything that I read about him came true. He is one of the only doctors that after my surgery, he actually would call me up several times during the week and find out how I was doing. He truly cares about his patients. When I tell you that I came home and the first time my wife looked at my incision, she said, "It's absolutely beautiful." And I said, "What are you talking about?" And she looked at it, and the incision was so clean and so straight. Dr. George actually took the time and has the professionalism where he removed scar tissue from all my previous surgeries.
When I first met Rick, he was telling me how much of a sense of humor he has, and as a matter of fact, he made a couple of jokes in the office which I still think about to this day. But actually, after surgery in this recovery period, I can really see that this guy has a tremendous sense of humor, because now it's like, compared to the 2 jokes I had in the initial consultation, he tells me at least 10, 11 jokes when he comes into the office, and he constantly has me laughing. And this goes to show that his quality of life and his all his normalcy is coming back, and I'm very happy to see that.
Now I can stand up straight. As a matter of fact, I'm actually taller than Dr. George, and I didn't know it until after the surgery. So now I get to see my wife eye to eye. Before, my eyes were up at her chin. It's amazing how this procedure has changed my life, because now I can function again. I haven't been able to function like this for years. I am going to be riding. As a matter of fact, my wife ordered me a new motorcycle. I think Dr. George will agree that the way I'm healing is far better than expected, and I expect that I'll be riding in the spring like I should be.
In Rick's case, he, going back to driving the motorcycles, and that's his passion. That's what he likes to do. For me to get him back to doing those types of things gives me tremendous amount of joy, and that's really the reason why I do what I do.
I can function again. I haven't been able to function like this for years, and he gave me my life back, and I owe my life to him.